Transforming depression treatment, ketamine shows promising results in new study. Ketamine offers new hope in treating severe, resistant depression, says a comprehensive U.S. study. This study, spread across 4 major medical centers, noted ketamine's rapid improvement in depressive symptoms and suicidality. Researchers aim to identify blood biomarkers for better targeting ketamine treatment, enhancing its effectiveness for individuals. Administered intravenously, ketamine showed promising results, with 52% of participants achieving remission in under 2 weeks. The BioK study observed significant reductions in depressive symptoms, suicidal thoughts, and anhedonia among participants. Despite its promising outcomes, the study's lack of a control group and its open-label design are notable limitations. The study hints at a future where ketamine could be a standard treatment for depression, guided by personalized blood tests.